me sing it. That's right. Better late than never. Okay, so I'm going to turn it over to you, Felix. Thank you.
Good afternoon. How's the annual meeting been for you this weekend? I would like everybody to give Dr. Mike Margolis a round of applause for appreciation of the wonderful job he did for this weekend's program. Okay, so how many of you have patients who grind their teeth in your practice? Okay, so let's get an idea. How big is the problem? 20% of the patients? No. 80%? 80 plus percent. Yeah? Yeah. Okay, all right, so we know this is a problem. And this has been an interest of mine ever since I got into dental school. I mean, why would the body mutilate the hardest tissue it has? Okay? So it wasn't until I studied sleep medicine that I found the answer. Okay? So I'm here to share with you what I discovered along the way and show you a few case reports that will prove that teeth grinding is really sleep bruxing as a result of airway obstruction. This is a patient who showed up with this condition. He had just moved into my area from Arizona. He's an integrated physician, and that's what he came in with. He said, my teeth came out on my pillow one morning. I said, why didn't you put it back? He said, you didn't understand. The roots come with it. Okay? That's his mouth. Can we turn the overhead light down a little bit on this thing? I got it. Okay. All right. So anyway, you can see that the mouth is very clean. Okay? Why did he lose all those teeth? All right? Why did he have so many fractions, so much wear and tear? And how do you explain that his three-tooth bridge ends up on his pillow, roots with it? Well, we saw a lot of abfractions, and the abfraction is connected to bruxing. That's nothing new. The question is, how do you treat abfractions, and how do you stop bruxing? We know the consequences of teeth grinding, right? I mean, general dentists basically deal with the consequences of malocclusion and teeth grinding. So I believe sleep bruxing is the cause of many endo symptoms, many endo failures, tooth loss, implant failures, when hygiene is excellent. And I'm blessed with patients who have excellent hygiene, because many of my patients are Western A Price Foundation members, and yet they suffer these consequences. Do you have this problem in your practice? Yes? No? Okay. All right, so why did he lose two teeth? And they're opposing each other. Okay? It's this tooth that was lost. Anterior bruxing. Why do people have anterior bruxing? Okay? Here's a 17-year-old who was ground through her night guard 3 years after her ortho. She ended up with anterior open bite. Does she look energetic? No. Okay. Why? Well, it turns out that sleep bruxing is microarousals in the brain during sleep. Okay? Microarousal 3 to 15 seconds in REM and light sleep. The EEG spikes 4 seconds before the Bruxing event, and heart rate spikes 10 seconds after. That means teeth grinding is associated with a stress event. I theorize that it's oxygen deficit. Because when you're sleeping, what can stress you? Really, okay? So, and jaw movement is connected to chest movement and limb movement, periodic limb movement. You know, anybody ever been elbowed by your sleep partner or kicked? All right. So why would these movements occur? Well, we've all seen it in movies where pillow put over somebody's face, and before you know it, the limb and the leg start thrashing, right? Same thing, okay? Only the pillow, okay, is now the tongue in your throat. So I believe teeth grinding is an oral manifestation or oral airway obstruction during sleep. Is this a new idea? No. Okay. Okay, let's talk about sleep. Sleep is downtime or active time. When you're sleeping, you're actually very busy. Your body is busy doing a lot of things. Growth hormones, repairs in adults, neurotransmitters, the renewal. Your histamine keeps you awake now. Your serotonin makes you feel good. Your dopamine gets things done for you, okay? How do you have the energy during the day? It's because when your body is not active overnight, it's, in the muscular sense, it's very busy doing these things. Information processing and memory consolidation. If you don't get a good night's sleep tonight, you won't remember what I said this afternoon and what Dr. Levy said this morning, okay? Parasympathetic time for detox and renewal. Immune boost and illness recovery, okay? What is the common sense thing to do when you're sick? Go to sleep, right? What happens when you sleep with your airway obstructed? You don't get well. Got patients like that? Yes. All right, okay. So sleep requires oxygen in a wide open airway. So does wellness, okay? So sleep bruxism is associated with an increased sympathetic cardiac activity, okay? Sympathetic activation clearly precedes sleep bruxing onset in moderate and severe bruxers. So warning incisal edges, we're not going to look at it like, oh, okay, you need a veneer or a composite patch. You're going to suspect that this has got an airway problem behind it. This photo is taken with the patient seated upright. It's not because the camera angle is off. Okay? You think this is another reason why she grinds her teeth? Okay? All right. So I believe that every night guard is a missed opportunity for airway diagnosis. Okay? Because if the patient is compliant, they wear it and they keep grinding. If the patient is not compliant, they won't wear it, and you just took their money for nothing. Start looking at the patient's faces. This photo is taken at 2 o'clock in the afternoon. Okay, I have patients who said, oh, really, you're supposed to wake up refreshed? I thought it's normal to take half a day before you wake up. Okay? He felt like that. Okay? And you start putting this together with this. And how did this happen? Why? This is a lot of restorative work before you can start applying therapy. Okay? Okay. Melatonin is a powerful anti-inflammatory for the central nervous system. Okay? It's made in the pineal gland from serotonin in a circadian manner. That means that your patient better follow the day-night cycle. You cannot burn the midnight oil and stay up all night and expect to be well. Okay? It's ubiquitously acting free radical scavenger. It's efficient in detoxifying reactive oxygen species. This is from this article here. Okay? So poor sleep means poor immunity. Here's the molecular basis for it. This is a mistype. This is CPR. CPR means airway before breathing and circulation. Okay? You need to have the airway open before the patient can breathe and before they can sleep. How am I doing so far? Okay? All right. So sleep. Sleep Bruxing is an oral sign of hypoxia. One sentence summary. Okay? The brain runs on two fuels, glucose and oxygen. When you're sleeping, are you getting glucose? It's running on glucose, but you're not eating and you're not digesting. Okay? You're running on oxygen. So I see sleep Bruxing as a self-CPR during sleep to open an obstructed airway. When you do CPR, what's the first thing you do? Airway. Airway. You thrust the mandible forward, right? But the teeth are in the way. So now your autonomic nervous system has a choice to make. Do I go for airway or do I save the teeth? Airway. Bingo. All right. So this is the reason why when I studied with Dr. Singh, he said evaluate airway before teeth. It just like, bingo. This is what happens, okay? And you can predict from the front of the face what the back of the airway is going to be like, because there's so much tissue that's going to have to fit in between this and this zone. Does that make sense? Yes. Okay. All right. So what I hope to do is to connect the mouth with the dental side through Bruxing and medical side through airway and obstructive sleep apnea for you. So I hope to just connect these few dots for you. Wide open airway. White on this color scale means the airway is not susceptible to collapse. And these patients all have a nice convex profile, youthful looking. Okay? This lady will age well. She won't have so many wrinkles. She won't have so many PMS. Okay? Upper airway spaces. There are 4 functional spaces here, okay? The nasal passage, the nasal cavity, nasal pharynx, and oral cavity. A good airway needs all 4 zones working, okay? If this is too small, if this is obstructed, as in children, you'll have a problem. People with narrow maxillas, they'll have a problem here, okay? If the oral cavity is too small, you'll have a problem here. And I'll show you a few cases. But the point here is all 4 zones need to work. And that's your job. See all 4 zones as a doctor of holistic mouth. Okay, 43-year-old with history of testicular cancer. What's his profile like? Okay, what's his airway like? Does that surprise you? But not until you put this together. That's his real photo, okay? His profile should have been developed like this, okay? Notice that he's got a severe ankylosing. This is the reason why he had a deficient profile. And next year, I hope we have the opportunity to discuss this as a major source of craniofacial underdevelopment and malocclusion, and a big reason why this happens when they become adults. We have an opportunity as dentists who see children to solve this problem so that under your watch, they don't end up being a sleep apnea adult. Okay. All right, so this is his sleep test. Okay? He's a poor sleeper, 76%. That means from the time you get into bed to the time you fall asleep to the time you wake up. All right? The percentage of the time you're asleep while you're in bed. He was asleep only 3/4 of the time. Okay? That's lousy sleep efficiency. Medical diagnosis, sleep bruxism and leg movement present. Minimal respiratory disturbances. That means that in the sleep doctor's opinion, it was not sleep apnea. Okay? Now, does that mean I'm wrong? No. Here's why. Bruxism and leg movement was his diagnosis. Now let's look at this. 25% of patients with sleep apnea have sleep bruxism. Okay? 54% of mild OSA patients and 40% of moderate OSA patients, they have sleep bruxing. So that patient was on his way to becoming a sleep apnea patient. This patient was a pre-sleep apnea case. Should have been called OSAS, UARL. Yeah, okay? So they missed the diagnosis there. Upper airway resistance syndrome. Okay? All right, so the main point is this. Taken all evidence together, bruxism appears to be mainly regulated centrally, not peripherally. What does that mean? It means that this is not a dental problem alone. Teeth grinding is a central nervous system issue, and the dental expression is just one frame in the movie. And we dentists are dealing with just that one frame when there's a whole picture to deal with. Okay? So, can sleep bruxism be linked to sleep apnea? Yes. Okay? So, let me just go over a few things since we were discussing that patient with testicular cancer. You have the power to control the patient's cancer outcome if they have sleep apnea and if they have signs of oral airway obstruction. Sleep disorder breathing is associated with increased cancer mortality. That's the conclusion. Does that make sense? You have low oxygen. Would cancer thrive in a low oxygen environment? Yes. What's the best way to fix cancer? High oxygen environment, right? Okay. So what they found was, in University of Wisconsin, they found that patient with severe sleep apnea, the chances of dying from this cancer is 5 times greater. This is compared to cancer patients of the same type. Okay? So someone who's got breast cancer, and one has obstructive sleep apnea, the severe type, and one does not. The one with the severe obstructive sleep apnea would have a 5 times greater chance of dying from that breast cancer diagnosis. All right, so I think we should see teeth grinding not as teeth grinding. We should see teeth grinding as sleep bruxing, and we should see it as an airway disorder. So this is, if you carry this acronym in your head, SBAD, it cannot be a good thing for the patient. Okay? So on the dental side, you can help solve many dental trouble related to teeth grinding. Okay? On the systemic side, you can solve many problems related to cardio, cerebral, and endocrine problems, which if we have time later on, I'll show you some connections. So for now, let's just stay in the mouth because we're going to be wet finger dentists seeing dental patients in our office. So tongue crenation means tooth prints on the side of the tongue. It reduces sleep efficiency from the usual 85% to 71%. Okay, so sleep efficiency goes down, oxygen saturation goes down. It correlates with the Mallampati score. Notice that this is very crowded lower anterior teeth. This is an underdeveloped jaw. So if you see tooth prints on the side of the tongue that is not grossly swollen, it is suggestive, okay, of sleep apnea risk. So now let's go back and see this case that I showed you at the very beginning, okay? The one with the tooth that end up on this pillow, the three-tooth bridge along the roots. Do you have a diagnosis now? Or at least the diagnostic suspicion now? Okay. Now I hope you grow some new eyes on how to recognize some of these cases, okay? His tongue is a 6-foot tiger in a 3-foot cage that's framed by the maxilla and the mandible. The mouth is too small for the tongue. And where does the tongue go? Right. Okay. So this is a study done by a group of ENT physicians in Barcelona. If you don't have a CT, you can do this battlefield diagnosis. Patients love this. Every time I speak, they all go to the bathroom and say, oh my God, I have this one or I have that one. Okay? This is very simple. Can you see the uvula? You can. If you cannot see the uvula, the patient is in trouble. It's that simple. Okay? Can you see the uvula? This is a pathological tongue. Not only is there tooth springs on the side of the tongue, this is a thyroid tongue. This is a hypothyroid tongue. Anytime the tongue is that swollen, okay, it's hypothyroid. All right, now many of these patients will end up with a midline discrepancy. A lot of these patients will be in pain. And it's not just TMJ, it's cranial and it's cervical, because the dental cranial midline and the spinal midlines do not line up. Because the mandible has to find a way to fit into the maxilla, and it has a hard time, and something gives. This is one of the consequences of malocclusion, neck pain. Okay? So you don't want this to be under your watch. Okay? A tooth doctor will see, okay, let's fix this. Maybe I get to do a veneer wall-to-wall. But that's not the issue. The issue is this, the issue is this, and the issue is sleep Bruxing airway disorder risk. So now you get to put it together for your patients. Really, that's what the patients want. They really don't care what your license says. I'm sure many of you have this experience, right? They just want to get well. And if you can help them, they love you forever, okay? Dentists used to just say, oh, I do teeth. What's white is mine, what's pink is somebody else's. No. Your patient's problem is your problem. And they'll respect you for it. And if I don't know the answer, I'll help them find the answer. I'll learn a few things along the way. All right, so if they're lucky, they get investigated for airway problems through the orofacial clues. If they're not lucky, they end up with all these issues later on. This one is my addition. Everything else was listed from William Dement, who is the Dement at Stanford. Yeah, he's considered a father of sleep medicine. So they end up with cardiovascular problems, endocrine problems, reflux problems, metabolic, diabetes problems, brain problems, immune problems. Let's face it. When you have oxygen deficiency, what can happen? Yeah, when you can't sleep, what happens? All of this. Okay? It's not that difficult. But I think sleep bruxing is really a leading indicator. We can see all of these coming. We have the power to help divert them to the path less traveled. This is what I mean by a 6-foot tiger in a 3-foot cage. Okay? This is the incisive canal. This is the mid-sagittal slice. And this is the tongue. Most people say, I have no idea the tongue is that big. Okay? Genioglossus, geniohyoid muscles. This whole group of muscles right here. Okay? So when the cage is too small, this tongue falls into the airway, and the body reacts to the tongue in the airway like a tiger, threatening its survival. And if the patient is lucky, they get a sleep apnea diagnosis, they get a CPAP mask put on. How many of you have experience with the CPAP mask? Okay. Most people don't like it, okay? And most people want some kind of alternative to it. This is a new patient who came in last month, presenting complaints: erectile dysfunction, memory decline, teeth grinding, and he had a CPAP from 4 years ago, and he's not sleeping with it. And he would rather live with these problems, but he would than wear CPAP. But if he given a choice, he would rather not have these problems too. So, look at his airway. Look at his wear and tear. Look at his crossbite. This means maxilla underdevelopment. Something stopped his maxilla from reaching class 1 normal occlusal relationship. Okay? All right. Why does he have so much erosion? Why does he have recession? Why did he have so many crowns? And why does he still have so much unrestored dental work? We get to play Sherlock Holmes, do a little detective work, right? Turns out that he has acid reflux, right? His tongue is stuck in the throat in your sleep, and you go, and then all the acid comes up with it when he succeeds. And night after night, year after year, the dentist is chasing the aftermath of the acid reflux from sleep Bruxing airway disorder. Does that make sense so far? Okay. All right, so that's his sleep test. Okay? Overall sleep apnea, apnea-hypopnea index is 16 per hour. Moderates, obstructive sleep apnea. If his dentist had the benefit of this information, could he have helped the patient? First, the diagnosis. Then we'll go into how to treat. Okay? So the official guidance from American Academy of Sleep Medicine is that if the sleep test score, AHI, is over 30, you do the machine. And I agree. You don't want to touch those patients. They have a lot of physiological dysregulation problems. Okay? But here, it's a joy. These patients come back loving you for what you do. Oral appliances are a simple alternative to CPAP. American Academy of Sleep Medicine admits that. Okay? And there's robust evidence showing their efficacy. This was 2006. This was before the DNA appliance came on the scene. DNA appliance came on the scene around when? It was 2009, I think. Yeah. All right. So what I want to show you is the oral appliance that they talked about was not this kind, which is the maxilla appliance. The oral appliance they're talking about back here before DNA came on the scene was the mandibular advancement device. And under your watch, you don't want the child patient to grow up and end up looking like this or like this. Because now you know how to do craniofacial recognition and malocclusion recognition. Okay? There are many footprints that lead to sleep apnea. It happens right under those dentists' noses. Okay? Sleep apnea is the result of pediatric impaired mouth initiators. We teach a whole course on how to manage children's dental facial development, okay? And then if the diagnosis missed, like you saw in the previous case, then the patient just go downhill this way, one thing after another. Memory, endocrine, hormones, aches and pains, immunity, until some catastrophe happens. Five-year-old, severe bruxing. Is it any surprise to you now that he's bruxing? Okay? What are you going to do? You're going to give him a night guard? You're going to put him on CPAP? Notice that his lips are apart. He has nasal obstruction. He can't breathe. He's got a 6-foot tiger inside a 3-foot cage. That's the reason why he has obesity.
How young can you treat a child?
You can start as soon as you can take an alginate impression. Before that, you can manage them. You can teach them how to manage the airway, how to close the lips, how to breathe through the nose, do myofunctional therapy. All right, obstructive sleep apnea in teeth grinding in adults stems in part from impaired development of the jaw and the airway. And you get to be in charge of this thing. So the patient doesn't end up with a 6-foot tiger inside a 3-foot cage. And that cage formed right under your nose every 6 months. All right, so the adult usually comes in with this kind of craniofacial profile. Okay, the lip is flat, mouth is open, there's big wad under the chin. Okay? And they have forward head, and they have posterior head rotation. They stand like this. It's the only way they're going to get their airway open. You've seen this before? Okay, so we, the dentists, every 6 months, we get to check, do they have good airway, represented by the green arrow? Do they have bad airway, represented by the red arrow? This is how long they live. This is their quality of life. This is the level of their health. The lousier the airway, the sooner they die, and the lower the quality of life. The better the airway, the longer they live, and the less trouble they have along the way. You get to be the first-line diagnosticians. So, I often ask my patients, how many of these symptoms you have on their first visit? And they'll just count it off. Oh, yeah, that's me. You don't have to have all of them. But many times they do. Okay, because these are the signs of restless sleep, long-term restless sleep. Oxygen deficient brain is the result of underdeveloped jaws and a 6-foot tiger inside a 3-foot cage. Like this. This maxilla is retruded. When both maxilla and mandible are retruded, what can happen to the airway? Simple. And it's obvious. And if you don't have a CT, all you do is do the uvula test. Okay? All right, so let's discuss treatment. Successful treatment of these breathing abnormalities related to obstructive sleep apnea may eliminate bruxism during sleep. I'm grateful for CPAP. I'm grateful for all the research associated with CPAP, because this research showed us that if you open up the airway, in this case using the CPAP, you can eliminate sleep bruxism. Okay? So they're treating it, they're finally getting to the root cause of this thing now. Teeth grinding is an airway deficiency problem. Okay? So, OSA is the highest risk factor for sleep bruxing. During CPAP titration, most breathing abnormalities were eliminated, and a complete eradication of the teeth grinding events was observed. Okay, if they can do that with CPAP, we can do it with oral appliance with superior patient acceptance. This is an example of the mandibular advancement device. This is what the American Academy of Sleep Medicine practice parameters was basing their research on. Just simply finding some mechanism to hold the mandible forward. Usually incisal edge to incisal edge. Maybe slightly forward, depending on the patient. That's all it is. In this case, we took this patient from 1.8 millimeters of sagittal width to 12 millimeters. Okay? This is another example of a design. This is called a EMA, elastic mandibular appliance. Okay? This is a semi-stiff, semi-flexible strap. And it simply holds the mandible downward and forward so that there's that much more room for the tongue. And the patient is grateful. I give you permission to share this information, and thank you. Okay? So when breathing, my airway seems bigger and was easier to breathe even when I'm lying down. Maxilla, however, is the game changer. Those are mandibular advancement devices. Maxilla is the game changer here. Okay? Maxilla is a complex, really. It includes the zygomatic bone and goes through the floor of the eyes and, of course, the alveolar portion. When the maxilla is well developed, you get facial radiance. It's timeless beauty. When it's not well developed, or when maxilla is retruded, there's no way anybody could be happy. So look at your patients' faces when they come in. Look at their profile, okay? She sent me this picture because this is what she has to do in order to go to sleep every night. Example of a well-developed maxilla. Michael Jordan figured out how to maximize his airway. Way out, okay? That's why he could sky dunk taller than anyone else, okay? Fully developed craniofacial skeleton makes winners, okay? The world's best athletes. I don't care what sport. When they get interviewed, pay attention. Look at their craniofacial profile. It's always convex, predator-like. Why? Even my first graders could figure out the answer to this question. Which one has more room in the mouth for the tongue? Okay? This is the same mouth. Okay? The power to make that transformation is in your hands now. A narrow airway is associated with narrow arch. A wider airway is associated with a wider arch. It's that simple. Okay? It depends on the patient, but here's my experience, okay? The patient feels better within the first week. Okay, and the result is usually achieved in somewhere between 8 to 12 months' time. Now, let's just go back here for a second. It depends a lot on what the patient brought. Sometimes they have bicuspid extraction. Sometimes they have deep overbite. Sometimes they have huge open bites. Those cases would take longer. Okay? So this is my own case. And what you do is you put a key into the slot. There's a opening here, you put it in, you push it in the direction of the arrow, and the edges open up. 1/4 millimeter, like Dr. Singh says, okay? And gradually, over time, over a month time, it opened up 1 millimeter. And here's a summary. This was myself 5 years ago. Big wad under the chin because what? I had a 6-foot tiger in a 3-foot cage. I was born class 2, okay? That was my airway. My AHI was 23. Okay? Whoops, sorry, wrong button. Okay. So, after the maxillary expansion, I have normal class 1, and my airway was in the not likely to collapse range, okay? So pretty much I saved myself a lot of medical and dental complications, okay? And this power and this possibility is in your hands as well, okay? When you look at a patient and their profile should be convex, when they're flat straight down like this, you can bet that their airway is in trouble. I just want to leave you with getting used to seeing this patient from the side, all your patients. Just look at them from the side. And then you look to see, is that a problem? Okay, now, one look and you know this patient is in trouble, and one look you know that you can help this patient orally and systemically, beginning with the mouth. Okay? But first you evaluate. Chief complaint, I'm missing a battery. All motivation, no energy. Okay? And these people will gain weight. Mercola says that you can gain 2 pounds of body fluids in just one night for poor sleep due to stress. Okay? Many women, especially perimenopausal time, gain weight just because their hormones are off and they can't sleep well. Tyrosine is a basic amino acid. When it's sympathetic activated, acidic pH, it goes in this direction where all the stress hormones are. And eventually it goes from cholesterol to aldosterone, which is what? Regulates body fluids. Okay? Whoops. I went the wrong way, sorry. All right. So, but if the patient is in the parasympathetic state, the balance shifts to melanin, which gives the hair color, melatonin, and you know that is a powerful antioxidant scavenger for the central nervous system, and thyroxine, which is what? Thyroid. When you have low thyroid, you have all these problems. So you get to influence all of that, okay? We did the workup. We figured out her maxilla is too narrow by 5 millimeters in the premolar region, and in the molar region, too narrow by that much. And her maxilla is also retruded. Retruded means this way. Protruded means that way. So what happens when the maxilla is retruded? The mandible is also retruded, and what happens to the airway? Trouble. That's what it is. Flat facial profile would suggest airway obstruction. CPAP is not without its problems. If you wear this thing for 2 years, it will retrude the maxilla, and we will change the craniofacial form by reducing maxillary and mandibular prominence. Think about it. This mass has a certain weight, and it represents a orthodontic and orthopedic force night after night. Whoops. What happened today? Huh? I know. Yeah, I know, but I didn't do anything to make that happen, though. Okay. All right, so 49% of the maxilla is retruded, according to James McNamara, okay? 49%, all I did was I took these numbers and added. Half of your patients would have retruded maxilla. That means half of your patients are candidates for? Got it. Yeah, for trouble, right, for trouble, okay? Teeth grinding trouble and airway trouble. This measurement is indicated more cases of maxillary skeletal retrusion and protrusion. That's from the original research article, okay? So what do? In younger people, you do this. In older people, I also do this. I encourage them, if you can gain 1 millimeter, your body appreciates it that much more. And I have patients who've gained a lot of millimeters from wearing this, adults. They just wear it to sleep from after dinner to breakfast. They don't have to wear it at work or go to school with it. Okay? So,
Can you go back to that picture for a moment? Is there something they're wearing on their forehead and chin?
no. This is just a pad that you rest on. You'll see more pictures of that.
Okay.
Yeah.
So if you expand the maxilla, what happens to the mandible?
The mandible gets to come to whatever position it wants. It's not entrapped by the maxilla anymore. What happened to the occlusion? It's going to change. And you're going to manage that in phase 2. But here I'm just going to discuss with sleep bruxing as a lead into this big picture. Okay, so very simple. Good convex face means good maxilla development. Flat face, posterior head rotation, deficient maxilla. Okay? So does that make more sense now compared to the first time you saw this slide? Okay? All right. So you get to educate your patient through a question, interview questions that you get to become the first-line diagnostician. Teeth grinding is a canary in the coal mine leading to sleep trouble, weight trouble, and a whole host of oral systemic symptoms. Okay? Retruded maxilla and narrow maxilla is going to lead to sleep Bruxing airway disorders. Just remember that. So let me take you through a case. White sclera under the eyes means underdeveloped maxilla. The whole thing is shrunken here at mid-face, so this also shrinks with it. Does that make sense? Okay, so back to this case I showed you at the beginning. What do you do now, given what you know? Do you make him another night guard? No. Huh? Nope. Right. You don't put her on CPAP? Maybe. Maybe. Correct. Good answers. Okay. So she had ortho done already. She's ground away her cusped tips in the premolar region. She's got forward head, forward neck, posterior head rotation. She's tired. You're not going to give her another night guard. What are you going to do? Can you imagine somebody giving her a night guard? Okay. You're going to look. You're going to take some record. You can't see the uvula. Okay? She's mouth breathing. She's got narrow nostrils. Does she have a 6-foot tiger in a 3-foot cage? Yes. And this 6-foot tiger did what? It was a very intelligent tiger. It fought its way out of the cage in the front because it didn't want to block the back end. Okay? So start treating the cause. So here's what we did. We expand the maxilla because that's where the problem is. This is the difference between the mandibular advancement device, which is a palliative crutch, whereas the maxillary development gets to the root of the problem, gets to open this up, okay? So let's see what happens. You have to coach the patient how to unblock the nose so that they can close their lips. If you don't close your lips, you're going to have an anterior open bite, you're going to have a gummy smile. So you have to teach them how to breathe through the nose, reduce the tonsillar inflammation, okay, and then you're going to fix the 3-foot cage so that it's comfortable home office for the tongue, so that it doesn't have to go into the oral pharynx. Am I clear so far? Yes. Okay. So we talked to them about nutrition. This is, you heard Sally Fallon's presentation yesterday. We teach them on how to do butyric breathing training so that they can unblock their nose and close their lips. We worked up her case, figure out what's off, where, and by how much. Her mandible is not really the problem. Her maxilla is the problem. So we did one of these for her. Cephalometric analysis, I have a better picture. So we'll put her on this. She sleeps with this face mask. And look what happened to her posture. Why does that posture improve? Her airway opened. We didn't put her through any physical therapy. No braces. Just because she's breathing through her nose, close her lips, and appliance and nutrition. Right. And that power is in your hands as a result of Dr. Singh's pioneering work. And the reason why it's not the same person is because she's sleeping better. And the reason why she's sleeping better is because we took her airway from 7.7 to 24. So this lady, when she goes, okay.
Hi, my name is Riley Hart, and I want to tell you about my DNA appliance. This is my lower, and this is my headgear. I've been wearing all this for about 10 months. First came to Dr. Liao when I was literally just looking for a new mouth guard because I'd grinded holes in it. I was also losing my tennis matches with a tennis player, and didn't know why. Dr. Liao helped me realize what the problem was, and it turns out I had sleep apnea, my air passageway was 75% blocked, my tongue was too big for my mouth, and it was pretty bad. So this has changed my whole life. 10 months, it's made such a difference. I don't grind my teeth anymore. My whole profile has changed. I sleep better. I have more energy on the tennis court. I'm winning my matches now. And the whites under my eyes don't show anymore, which is great. And I also changed my diet, all organic, thanks to Weston Price. And it's just been amazing, and I'm ready to go into phase 2, which is braces. And yeah, thank you.
Makes me happy every time I see her. And that's how you want to practice. So that's a summary. You do dental facial development, you remodel the airway, you can change the patient's entire future. And with the help of Dr. Singh, we got this published in a journal. And so you say, okay, that's a 17-year-old. What about a 67-year-old? This is a retired librarian, okay? She wanted the same thing, and look at her lips. She went from no place to put her lipsticks to here. She's in phase 2 now. Okay? So you're in charge of the patient's airway. You're in charge of their airway. And by the way, her knee pain went away. And her back pain went away. But that's not what we target. Okay? We treat in the mouth, and the rest of it follows. And they're always amazed, and you're going to be amazed on what they come back and tell you. How am I doing with time? Okay, great. So you get to see some other cases. Pardon me? Oh, yeah. I just don't have time to show all the cases. We will do that when we do the DNA training seminars. Yeah. Okay, so this, you're in charge of how fast their health go downhill and how long they live. Really, the power is in your hands. Okay? Airway rules, the aging's downhill slide. Okay? And because you can recognize the oral and dental signs as leading indicators, and because now you have the potential to go take the course and get trained on this thing, you can determine whether they have a good life or a terrible life. Let's talk about leading causes of death in the United States. These are the latest figures available. Okay? Heart disease, cancer, and all of these things here, we used to think that it was the diet, and it was cholesterol, and it was sugar, and all of that thing. I submit to you that it's not just the diet, it's also airway obstruction. Airway obstruction accounts for all of these things just as much as diet, probably more, in my opinion. Okay? So, how can I say that? Well, the Journal of Cardiology, the journal that cardiologists read says OSA is behind 50% of the hypertension, 30% of the heart attacks, 60% of strokes, and 25% of the congestive heart failure if the patient survive all of that. Half of your high blood pressure patients is going to have obstructive sleep apnea. And you're in a position to do something about it. Here's a patient. Medical diagnosis, high blood pressure, obstructive sleep apnea. Her AHI is 11. Okay? You see her uvula? No. What's her airway? Trouble. Okay? I tell the patient, this means you're at relatively low risk unless you gain a lot of weight. Here, the train is coming your way. Here, the train is on top of you. And black means your train is running you over. Okay? Look at her profile. This is a suffering profile. Okay? Maxilla is too narrow. Mandible doesn't have that much crowding. Okay. Self-analysis. Mandible is retruded. Maxilla is too narrow. And the upper incisors bent too far in the palatal direction. This has to do with retruding the mandible. The more retroclined the upper incisors are, the more the mandible is forced back. Division 2. Okay? So what did we do? We put her on one of these maxillary and mandibular expanders, and we got her so that she could open, so she didn't have any more problems. And let's see if this will play.
Hi, my name is Jeanette, and I have been using therapy with Dr. Liao for about 15 months. This is my retainer, an upper and a lower. That's the bottom. And that's the top. Since I've been using the appliance, I'm not as tired as I used to be throughout the day, especially in the morning. My blood pressure has come down a little bit. I used to take medication, but I don't, we're probably going to have to reassess that with my regular doctor because it's getting lower and lower. We went from like 140/87 to on average like in the 120, 127 over 77. So that's really good progress there. And I used to have a lot of aches and pains in my neck and shoulder, and those are also improving since I've been using the oral appliances. And that's all there is.
This is a big problem that's way underdiagnosed. Way underdiagnosed. A lot of patients need help. And it's not just the sufferer, it's also the sufferer's sleep partner. All this says is that snorers have small oropharynx. They call it a critical pharyngeal cross-sectional area. I call it oropharynx right here, right behind the tongue. Okay? Snorers with sleep apnea have a further decrease in this space. This was way back in 1986. Okay? This is not a benign problem. This is not just a dating nuisance. Okay? You have twice the risk for heavy snorers. Heavy snorers versus non-snorer. What's a heavy snorer? If you snore more than half the time. Okay? So you have 8 times the risk if you're a heavy snorer with obesity and sleep apnea.
Hi, since I've started using the appliance, I've had more energy. My wife really appreciates it that I am sleeping through the night without snoring, and she's getting much better rest also. I also feel like I have more oxygen and more energy because of that.
His wife said to him, "You're going to sleep with the dogs and not me if you don't go see Dr. Liao." And once you start having this conversation with your patients, you got to build in new practice. Okay? So you get to help them with their heart attack risk, because people who's got OSA have a much higher heart attack risk, and it's linear. The higher their sleep apnea score, the greater the hazard ratio for dying of coronary artery disease. It's that simple. The more severe your sleep apnea, the more likely you're going to have heart disease. Okay, so with a simple questioning, simple intake interview, just dialogue. Teeth grinding is the leading indicator. Along with this symptom mix, you get to help them. People who are jaw clenchers and teeth grinders, start looking out for this on your 3D CT scans. Okay? Contraction of the jaw muscles associated with longer arousals and larger transient oxygen desaturation in sleep apnea patients. This is all proven. People who comes in and say, "I wake up with my jaws clenched." There. This is one of the big pearls I picked up from Dr. Singh. TMD, how many of your patients have TMD? Okay? Sleep disorder breathing, this they may or may not know. Malocclusion, this you know very well. Okay? 2 out of 3 is dental. Okay? This trial condition may co-present as undiagnosed craniofacial underdevelopment. So that's the diagnosis. What's the treatment? You redevelop the underdevelopment. Okay? Here's a patient. How long has he been clenching and grinding? Does he Brux? Okay? He came to me because this is a new patient. He broke that tooth off. Why did he break it off? He's a Bruxer, right? Okay. He's a Bruxer. I told him he should get a CT scan done, which he did. I told him to get a sleep test, which he didn't do. I showed him that he had the uvula and his tongue is asymmetrical. This guy's got cranial issues. 12th cranial nerve is impinged. Okay? So why is that important? Well, sleep bruxism is associated with rising arterial blood pressure. Okay, sympathetic cardiac activity was higher in sleep bruxism patients. What does that mean? That these people are going to be on high blood pressure medications, and they're going to break teeth. So you got to connect broken teeth with their heart medications that their internists put them on. Okay? It's all because of sleep and sleep bruxing and airway obstruction. Am I making sense now? Yes. Okay. So this guy ended up with a heart attack one morning. He thought he was a fit athlete. He rides the bike all the time to work. He's a Department of Justice lawyer. His total airway volume is 9.7. It should be above 20. Okay? So he's doing aerobic exercise on less than half of the airway volume that's supposed to be supplying his oxygen needs. No wonder he had a heart attack. Okay? So now you understand this. You understand how you, working as a mouth doctor, can help the patient avoid airway obstruction by seeing teeth grinding as a clue and a referral for a sleep test. If nothing else, you just do a sleep test, start a conversation, root out that possibility. I don't say to the patient, and you shouldn't either, because sleep apnea is a medical diagnosis. The official term is obstructive sleep apnea. That is not within your scope of practice. Okay, so I only say sleep apnea, but I tell patients, get a sleep test in. This is a medical diagnosis that needs to be made by a sleep physician, sleep specialist, okay? So you refer for a sleep test and start a conversation. You'd be surprised how many lives you can change just by doing that. And teeth grinding is one of the very simple things to recognize for us. So snoring is the start downhill slide, and just simply snoring. Part-time snorers have about 1.5 times for getting diabetes. Regular snorers, that means people who snore more than half the time, has 2.3 times the risk, okay? And snoring can progress into sleep apnea. How about Alzheimer's? Are your patients concerned about Alzheimer's? Oh, yeah. Big time, okay? It's one of those unspoken fears, okay? So this is a shrunken brain, okay? Why is it shrunken? What happens when you don't water the plant? What happens if you don't feed the brain oxygen? Same idea. Brain food is glucose and oxygen, and maxilla is a big part in both of them. Not just with eating, but through oral airway, okay? Here's a study. Elderly women with sleep apnea are twice likely to develop Alzheimer's. What's the next study we should do? Maxilla size in Alzheimer patients, right? Wouldn't that be fun? Martha, let's do one. Yeah? Yeah? Okay. So the adjusted odds ratio, okay, that means they take out the confounding factors, is 2 for dementia. If oxygen desaturation is more than 15 events an hour, that means moderate sleep apnea. You get twice the risk for getting dementia. You deprive oxygen to the brain, it's going to shrivel. Is that common sense? Yes. Yeah. Okay, so this is the way to do it. How do you prevent it? How do you be proactive on Alzheimer's? Medicine doesn't have an answer now, but you do. This is one of my favorite slides. I got this from Dennis Stroken. He was a practitioner in Vancouver. Every patient gets this. You know, all the bones in the bodies are connected. The craniofacial skeleton works like a Swiss clock. The craniofacial skeleton has its own postural chain, every bone is related to another bone in a reciprocal relationship. One turns one way, it turns the other way. Okay? And by tweaking, using teeth as a handle to tweak the maxilla, you can affect the pituitary and cranial respiration. What about sinuses?
Hi, my name is Jessica Shellick, and I give Dr. Liao permission to use this for educational purposes. I'm from Lynchburg, Virginia. It's about 3 hours away, and this is my 4th month with the DNA appliance. These are my appliances. I've gained about 1/4 of an inch on each of them in my mouth, and before these I had 2 sets of braces that have just resulted in more issues than I ever expected. I have TMJ, sleep apnea, and allergies, and in the past 4 months I've not only has my mouth expanded and my teeth have straightened, but I've also on less allergy shots. I have less headaches, which I used to have them 3 times a day, and I'm more awake, which is, I'm just excited to see what else comes from these appliances.
Thank you very much.
Mm-hmm.
She had braces in her mandibular inferior teeth, had to have reverse her.
She had braces twice before she came to me. And it's because they were trying to get the braces done without looking at the airway and without trying to treat the maxilla to open up the airway. They're just trying to line up teeth. That's all they did. So this patient wanted to see if, was given a CPAP, and then looked me up and said, hey, can I have an oral appliance? Well, before you tell them yes, you had to do your homework. And so his maxilla is retruded. That means that the anterior nasal spine, the most forward point of the maxilla, not the teeth, but the maxilla, is behind an AP view, the most forward point of the mandible. We call this the B point, we call that the A point. The A point is -8, the B point is +6. Okay? So he's got a cranial skeletal deficiency in the sense that the maxilla is too retruded and the mandible is too far forward. So that would change the treatment a little bit. I encourage adults to wear this in addition to the usual DNA appliance in that case because of the severe, well, not severe, this is considered moderate maxillary retrusion, okay? That's him.
Hello, my name is Robert. I'm from Stafford, Virginia, and I've had about a week's time now with the DNA appliance.
1 week.
I wear both the upper and the lower piece. I had been using CPAP in the past, didn't care for it at all. Did get some relief from my sleep apnea, but I do prefer the DNA device. Less care as far as the hoses and cleaning, and I'm feeling quite refreshed. Don't need a nap in the afternoon like I had in the past. So if you're thinking of trying it, so far it's been a very positive experience for me. Thanks a lot.
That's what the appliance therapy did for him. We took him from this off the scale black to mostly white. This is his maxillary retrusion. Okay?
How long did that take?
That took 15 months. And that's him 1 year after the DNA appliance.
Hi, this is Robert. This is a follow-up video, and I give Dr. Liao permission to use this for educational purposes. It's now been a couple of years since I started treatment with the DNA appliance. I wore it for about a year, and this is like about a year follow-up, completing that. And I continue to be very pleased with the decision. My energy level is much improved, no need for naps in the afternoon, and no need to be tossing around all night with that CPAP machine on. Would never go back to CPAP. Enjoy still using the appliance at night to keep everything in place, and if you're considering it, I would suggest looking at that option for you as well. Thank you.
Yes, because he had a severe case, and I encourage him to gain even 1 millimeter is a plus for your airway.
My name is Tricia McKenna, and I've had the dental appliance in for about 6.5 months, and noticed some definite improvements in my overall health. For one thing, it's easier to floss, and it's also my jaw is less tense. And the most important thing I've noticed is that I have a lot more energy during the day. I have 5 children, and was very hard to keep up with them. I was always exhausted and sleepy during the day. And I'm no longer desperate for a nap all day, every day. And my kids don't know.
You know, have you ever encountered this teeth contact is so tight you can't pass a floss through them? These are chronic bruxers. Teeth are bruxing night after night after night after night. Okay? That's an indication. Here's another patient. Forward head. Look at those neck. Look at how far forward her ear is relative to her shoulder point. Okay? Pain. Many of these patients will have aches and pains. And aches and pains beyond where the malocclusion is. Okay?
Hi, my name is Stacy Kaufman. I'm a patient of Dr. Liao's, and I give him permission to share this information with his patients and other doctors, anyone that this might help. I have been seeing Dr. Liao for 3 months, and I have been wearing this upper appliance, which is a DNA appliance. And at first, I was not very excited about wearing this, but I have grown to actually love this thing and rely on it because it is helping me improve my health. Some of my health benefits that I have noticed, and my partner, Joe Kauchi, has noticed, are that I am sleeping through the night. I'm actually dreaming. I have dreams, vivid dreams every single night, and I wake up feeling refreshed. I also can concentrate more during the day, and I have great energy throughout the day, including the afternoon. So this has been nothing but a positive thing for me, and it's only 3 months into the game, and I'm very excited to see the end result. Dr. Liao has also taught me how to breathe through my nose. I no longer have to use any of my steroid medications, my Sudafed, my Allegra, any of those. I no longer get sinus infections. I no longer feel the need to breathe through my mouth to get air. That panic feeling is just gone. It's no longer within me. I feel a lot more comfortable breathing through my nose and just being able to relax.
I'm just going to skip the thing here because there are a couple other things I want to get across. But she originally came to me because she wanted to get the amalgam fillings removed. And removing amalgams, she thought was going to fix everything. Okay, and she was highly anxious. Okay, this is her husband.
Hi, my name is Joseph Kauchi. I'm Stacy Kaufman's partner. I give Dr. Liao permission to use this video for his clients or whoever he needs to for educational purposes. Stacy has experienced a lot of really positive results from this, particularly for me, the noise in while we're sleeping. She doesn't snore like she used to. She used to have that, that closed feeling that you could hear it. It would keep me awake. I'd have to nudge, keep all night. None of that happens anymore. It's just totally gone. One of the other things that I've noticed from her saying is that she's totally awake in the the mornings now. She's not groggy anymore like she used to be. She's sleeping through the night. She's not waking me up, getting out of bed, getting back and forth, or fidgeting, all that fidgeting, when she's like gasping for air. None of that's happening anymore. She's just sleeping all the way through the night, and then I can sleep better too. So that's wonderful. And again, she has a lot more energy now too. She doesn't have any of the things going on where she's, having to medicate herself, or she's sick all day. She just has all this energy. And she has talked about recently her flight, the flight she had. She talked about how she used to have problems, and I experience this too, when I'm flying, pressure when descending. She said it used to be so bad she used to have to hold her neck like this. She doesn't have to do any of that anymore. And I can relate to that because I experienced a similar thing when I'm in planes. So this has all in all been a great experience. Dr. Liao has been there every step of the way with us. He's consulted us about anything that we needed to know about ahead of time, during, or even after. And and because Stacy also had some resolve.
Okay, so in the interest of time, I'm just going to cut it short and close it here. And I just want you to know that this power to help the patients dentally and systemically in your hands. And if you don't do it, nobody else can. And you can do this simply by recognizing that teeth grinding, which we said at the very beginning, is a big issue in all dental patients. Just simply by connecting that with airway investigation. And that's all you need to do, okay? You can solve a lot of problems. I want to thank you very much. I want you to know that Martha here is a certified instructor for DNA appliance systems along with myself. I think there's Tara Griffin in Florida, okay. On the West Coast, there's Dr. Singh. And so, get trained, and the power to transform the patient will be in your hands. So any one of you who has any questions, feel free to ask Martha, who's an expert in this. We just like to, use these cases to help the patients orally and systemically. For me, I personally made a journey from biological dentistry into airway and oral medicine, and this part has been by far the most satisfying thing I've ever done in my dental career, as you can tell for some of these patients' feedbacks. So thank you very much. And
Felix, on behalf of the organization,
thank you.
We also want to thank you. And you guys, please visit the vendors, but you need your code. And those of you who have not done your vignette, this is your last opportunity because they are throwing us out of this section. As soon as we finish, they have another group coming in. And so then for the rest of the afternoon and evening, we'll be over in the bubble.
So go record your video. This is your last chance. The code is 10FL, as in Felix Liao. So 10. So it's 10FL10.